Hello, assalamu alaikum. How are you, everyone? Today, I'm going to talk about a myth that prevails in our day-to-day clinical practice, and a myth that directs to a big industry and severe polypharmacy in several cases. The myth of calcium deficiency and supplementation of calcium and vitamin D3 fixed dose formulations. Mm, it is already prevailing in the internet that it is a myth and it is a uh, act of polypharmacy. Look, there are several use cases where calcium and vitamin D3 fixed dose combination supplements are widely prescribed. For example, commonly following fractures, orthopedicians prescribe this, although there is no evidence anywhere whatsoever that it helps in direct or indirect bone healing. No evidence whatsoever. We will go to the basics of calcium homeostasis later. Let's first discuss the common clinical use cases where these supplements are overprescribed, overmarketed, overprescribed, and huge sale. It's a big industry, I am telling you. So I'm afraid big pharma will be afraid after me, following this content. Then we come to the prophylactic use in case of empirical diagnosis of osteoporosis. In old age, elderly cases, calcium supplements along with vitamin D3 are widely prescribed to prevent osteoporosis or to replenish calcium stores in empirical diagnosis of osteoporosis. In most of the cases, there is no working diagnosis of osteoporosis. A DEXA scan is necessary for diagnosis of osteoporosis. Without doing a DEXA scan and knowing the T score, uh, you cannot diagnose osteoporosis. So in these cases, calcium and vitamin D3 fixed dose combinations are supplemented and prescribed for long term. Basically 500 milligram plus 200 international unit vitamin D3 in fixed dose combination in BD dose for 2 months or 3 months. Okay. This is the next common use cases. Then in obstetrics and in obstetrics practice, in pregnancy, during pregnancy, it is even prescribed along with iron supplements. Although it is known to all that calcium supplements can temporarily reduce iron absorption. Despite this, it is widely prescribed that in pregnancy, especially during first trimester, calcium supplements are given. Next common use case is a vague symptomatic treatment of cramps or muscle pains. It is given as a symptomatic treatment in a straightforward way. Next common use case is a placebo effect, and then comes strengthening tooth. Although the mineralization of tooth, this calcium and vitamin D3 fixed dose combination supplementation has no role whatsoever. I assure you, no role whatsoever. Now let's come to the logics. Why I am against this supplement and why should I be? From my first experiences in government service, in Bangladesh civil service, in being posted as a medical officer in a remote upojela in Bangladesh, and prescribing OP, PC, and calcium. OP stands for omeprazole, PC stands for paracetamol, and calcium. These were the fixed prescriptions to all the patients. All the doctors do this because there is no time for diagnosis, there is no time for listening, just disbursement of the medications from the free medical store. Two, elite society who comes from New York. Recently, my uncle came from New York and he eagerly bought some calcium and vitamin D3 fixed dose combination supplements, very expensive supplements in gummies form. So it is chewable, like a chewing gum. These are sold in a scientific country like America, and I have read the labeling. Many things are written there, like it may prevent osteoporosis. Look, they have added the word may before the promotion. May prevent osteoporosis, strengthens bone health, strengthens tooth health, improves muscle health, then boosts immunity. How come I don't know? These are all lies and marketing techniques. Look, now let's come to the logics. Calcium is a very tightly regulated electrolyte in our body. Very tightly regulated, even more tightly regulated than potassium. Its normal value in blood is 2.2 to 2.6 millimole per liter. That is the ionized calcium form, and this is the physiologically active form. And it is essential for following things like muscle contraction, nerve transmission, blood clotting, hormone secretion, and bone and teeth structure. The calcium hydroxyapatite crystal. In calcium homeostasis, it is a broad spectrum of endocrine activity involved there, and three key organs are involved: bones, kidneys, and intestines. Bones are the major calcium reservoirs. 99% are stored here. And kidneys regulate excretion or reabsorption of calcium, mainly in the proximal convoluted tubule, and intestines absorb calcium from food. And what are the hormones that are regulating calcium homeostasis? Number one is parathyroid hormone, secreted from the parathyroid glands. They increase bone resorption and release calcium, increase reabsorption of calcium in the proximal convoluted tubule of kidney. They activates vitamin D and thus increases intestinal calcium reabsorption. Vitamin D, the active form is 125-dehydroxycholecalciferol. They increase calcium absorption from intestines, and they also work with parathyroid hormone to mobilize calcium from bone. Another hormone is calcitonin, secreted from parafollicular or C cells of thyroid. They are released when blood calcium is high. They inhibit osteoclastic activity, so they stop bone resorption and decreases blood calcium level. So these are the hormones that work in the endocrine orchestra of calcium homeostasis. There are feedback mechanisms involved. When blood calcium level falls, I again repeat, calcium is a very tightly regulated electrolyte. When blood calcium level falls, bone releases calcium, kidneys retain calcium by increasing the absorption of calcium, and vitamin D gets activated and intestine absorbs more calcium. And in the contrary, when blood calcium level rises, bone osteoclastic activity is reduced, so there is reduced bone resorption, and more calcium are excreted in the urine. Role of bone remodeling. Okay, now let's come to the role of this calcium and vitamin D3 fixed dose combination supplements without testing the serum calcium level or vitamin D3 level. Blind supplementation of them, what do they do? They ignores the tight physiological regulation. I have already mentioned that calcium, I again repeat, calcium is a very tightly regulated electrolyte. So, the most deficiency is actually vitamin D deficiency, not calcium deficiency. And there is also dietary source of calcium. And intestines can absorb some maximum of 500 to 600 milligram of calcium at a time. So, in this case scenario, having the endocrine orchestra, the hormones playing role in calcium homeostasis, and dietary source, plus if you give blind supplements of them in excessive doses to promote bone health or tooth health or general physical well-being, what do they do? They may lead to some serious side effects, like they will ultimately be excreted in the urine, and there is increased risk of calcium oxalate stone formation. Plus, they will increase the risk of arteriosclerosis, vessel wall calcification, and also increases the risk of myocardial infarction. There are some side effects of them, like constipation. So in elderly patients, most of them are like you will say that osteoporosis is very common, very common. So to prevent pathological fractures from osteoporosis, we can give blind supplements. Look, carcinoma of colon in this age is also common, and constipation is a risk factor for it, and calcium causes constipation. So, ultimately, what we see that this calcium and vitamin D3 supplements have no benefit whatsoever without proper indication. But they can be used for therapeutic use in cases of documented hypocalcemia. And remember, calcium deficiency is a myth. There can be hypocalcemia or hypercalcemia, two situations. What is calcium deficiency? It's a total myth and a marketing hoax by big pharma. So the indication of therapeutic use of these supplements should be documented hypocalcemia, osteoporosis, a working diagnosis of osteoporosis, chronic steroid therapy to prevent, in these cases, prophylactically it can be used, sedative with hypocalcemia, and postmenopausal women with low intake. And supplements, if needed, in these cases also, first consideration should be given to improving dietary supplementation, not through swallowing a pill, by improving dietary supplementation, improving dairy product intake, improving fish intake, improving meat intake, and increasing broad daylight exposure for vitamin D, and exercises. So, from public health perspective, in many populations, if dietary calcium intake is already adequate and sun exposure corrects, vitamin D. So, mass supplementation, what does it cause? It increases unnecessary cost, increases pill burden, and polypharmacy, and adds risk without benefit. What are the risks? I again tell that from basic physiological mechanisms, there will be increased risk of kidney stones, there will be increased risk of arteriosclerosis, vessel wall calcification, and even it increases risk of clogging arteries leading to myocardial infarction. And in a pregnancy case, if you give it with iron, it will temporarily decrease iron absorption. So, this blind supplementation should not be used. There must be a documented level of calcium and vitamin D3, and they should be used therapeutically. I hope everybody understand what I am trying to say. I am trying to raise awareness about polypharmacy and improve rational prescribing. Thank you very much. Assalamu alaikum.